Back with Bobby and JJ Radio, we have a very special guest this Sunday. It's Dr. Lindsay Bira. She's received a PhD in clinical health psychology at the University of Miami. She completed her residency with Boston VA and also went a fellow for both Harvard Medical School and Boston University School of Medicine at the National Center for...
Harvard Medical School.
Yeah.
I don't recognize you.
Yeah, he was mopping floors there between 2000 and 2003, 2007. I think you were a janitor, right?
Moving on.
Yeah. So she's also at the School of Medicine at the National Center for PTSD, where she was focused on treating veterans with combat-related trauma or comorbid medical issues. She's been hired by UTHSCSA, the University of Texas Health Science Center in San Antonio, in 2014 as a postdoctoral position in affiliation with StrongStar, the world's largest PTSD research consortium.
Mm-hmm, consortium.
Yeah, in the U.S., it's the largest.
In the world, actually.
In the world.
Mm-hmm.
I don't think people actually realize that it's here in San Antonio.
I know a lot of people don't. That's why I'm really passionate about telling people about our services and what we're doing at the Health Science Center with StrongStar.
Sure. So let's start with that. So talk to us about your role at UT or UTHSCSA.
Yeah. So as you mentioned, I'm a postdoctoral fellow right now for the UT Health Science Center within StrongStar and the consortium to alleviate PTSD. We receive all of our funding from the VA and Department of Defense, and we're focused on proper diagnosis, detection, evaluation, and treatment of post-traumatic stress disorder within our recently discharged veterans and active duty military. So I'm a therapist on our clinical research trials.
Got it. And so when you say you're actually trying to find out if people are need treatment first and foremost,
mm-hmm.
right? And if they actually do have PTSD or not.
Mm-hmm.
Is that one of the things that, is there a lot of people that don't know if they do or don't have that?
Yeah, so I think, because we've put out so much information,
Sure.
The field has really defined what PTSD
Mm-hmm.
is, and there's a lot of effort in helping people understand the symptoms. A lot of people are knowing what's going on, or they get caught in diagnosis at one of the hospitals, so the VA or another doctor's office. But sometimes it just feels like general anxiety. Sometimes
Sure.
they don't know what's wrong. They're seeing a lot of problems in their relationships.
Sure.
And that's
So
why they
how does somebody with PTSD get with you? So there's a step one where they're starting. They I guess they're going to the VA,
mm-hmm.
and how would they end up with you?
So they could see one of our flyers in the community. One of the providers that they have might know about us.
Sure.
That's why we really work to get the word out, because it's free treatment. We even pay people for participation. So they could also go to our website, www.strongstar.org, and
Sure.
check out all of our research trials that we have going on. We're offering the top-of-the-line, most evidence-based treatment.
Sure.
And what we're doing with it is we're adjusting it in certain ways just to see how it might work better for more people.
And so tell me how exactly you're involved with the StrongStar program here in San Antonio.
So I'm a licensed clinical psychologist, and I serve as a therapist on some of the research trials we have going on.
And so tell me, what are some of the research trials that you're doing at this moment?
Yeah, so two of the ones that I'm a therapist on, one is called our in-home study. So this is where somebody who comes in, they'll get randomized, so randomly assigned to one of three arms. Either I go into their home and give the treatment, so I go to them, or we do telebehavioral health. So we set them up with a laptop and a computer, and they call me or I call them. We do it through the video, or they come into the office. So it's the same treatment. We're just seeing, okay, what are the differences between these different arms?
Are you trying to figure out what's the most effective, or if one is as effective as the other one? Or
Yeah, different ways of delivering the same treatment. Or maybe some people with certain issues respond better to another way of delivering it. So it's just kind of broadening the treatment accessibility.
And do you feel that depends on that some people responding better or not better to the video part of it, depending on their age?
That's a really good question.
See, that's what I'm here for.
Yeah, I think that's definitely a factor.
Sure.
Now, the population that we work with has to be a post 9/11 veteran.
Gotcha.
Or active duty, still in. So that means they're relatively young.
So they should fall into all of that.
Yeah, so usually I haven't seen anybody with some kind of barriers to the computer in
Sure.
that way. But I think you're absolutely right.
Does it ever happen that you treat somebody that maybe turns out didn't have PTSD, they thought they did, or?
we have such a rigorous diagnostic process that we're among the top in the country with being really good at diagnosing. So we have a very focused process that nobody gets in without PTSD.
You think there's a lot of people that have PTSD that aren't getting treated, and if so, why is that?
Yeah, absolutely.
Well, we've had shows about that.
Go down the list.
We've had shows with, Patriots Casa and stuff like that, and I think there's a lot of detachment on them feeling that there's something wrong or even emasculate to even admit it up front. Remember, we had that whole show about that, and then a lot of people don't know where to go, or they wait until it's too late, or
the barriers to care, stigma, not knowing what organizations are out there, having tried one treatment approach and just didn't like it, so they're hesitant to try another one.
Sure, yeah. So they just went down one avenue, either at the VA, and they didn't like it. But you're working hand in hand with the VA here in San Antonio, and letting them know to get as many of their quote unquote patients to use as soon as possible, I guess.
Yes. Yeah.
And are there other big institutions that you're kind of working hand in hand with here in San Antonio?
The SAMC, the Military Medical Center.
Okay.
So San Antonio has the largest military medical center in the U.S., I believe.
Sure.
And so we're very connected with them. And we have an office there, but mostly we see our patients elsewhere. But we're very active in recruiting.
It's awesome. We're going to take a quick break. We're going to come back with Dr. Lindsay Bira. If you want some more information about this, if you yourself are feeling that you need to be diagnosed or are diagnosed with PTSD, there's amazing stuff going on here in San Antonio. You can go to strongstar.org or call them directly at 210-562-6726. Again, that's 562-6726. You can also email Dr. Bira at UTHSCSA.edu. You can check us out on Facebook, Instagram, and be a fan of our show at bobbyandjjradio.com. We'll take a quick break. Be right back.